afternoon. Welcome to our webinar, Creating Access to Healthy Foods in Municipal Workplaces One Bite at a Time. My name is Marisa Jones, and I represent the Institute for Public Health Innovation. IPHI is a member of the National Network of Public Health Institutes, an organization of 38 members throughout the United States. With a focus on Maryland, Virginia, and the District of Columbia, IPHI strives to improve the public's health by providing a nexus for transdisciplinary collaboration that promotes health, reduces chronic disease, and builds community capacity to sustain progress. This webinar is part of IPHI's Heal Cities and Towns campaign for the Mid-Atlantic, helping municipal leaders create healthy, prosperous communities. The Healthy Eating, Active Living, Heal Cities and Towns campaign is a partnership between IPHI and the Maryland and Virginia Municipal Leagues to support local elected officials and municipal staff to adopt policies that promote access to healthy, affordable foods, physical activity, and active transportation, and municipal workplace wellness. We have heard from mayors and city council members we work with that workplace wellness is a priority in town halls throughout the region. At this time of year, when many of your employees and colleagues have likely resolved to eat healthier and become fitter, we are excited to provide information and tools to expand access to nutritious foods in the municipal workplace. After participating in this webinar, we are confident that you will be inspired and equipped to take action to create access to healthy, nutritious foods within your municipal workplace. A couple of housekeeping items. We would like to inform you that this webinar is being recorded and will be available to watch again at a later date. All of your microphones will be muted to ensure that all participants are able to hear clearly. If you're having a hard time hearing the webinar at any point, please let us know via the chat function. We also encourage you to dial in with your phone if you are having a hard time hearing through your computer. We would really like to hear from you and would like to include your voice in the conversation. So ask questions, share comments, even challenge our ideas. Use the question and answer panel on the right side of your GoToWebinar player to ask questions or share comments at any point throughout the webinar. We will answer questions for each of the presenters at the end of the webinar. We encourage you to submit your questions as they arise. We will also have a few poll questions. These will pop up right on your screen, and again, we ask you to answer them as they arise. At this point, I want to introduce our presenters so we can get into the content. First, we will hear from Sarah Rubin and Amy Friesen. Sarah is from the City of Minneapolis Health Department, and Amy is from the City of Minneapolis Benefits Department. Together, they will present on specific policies cities can use to expand access to healthier foods at meetings and events. Next, we will hear from Erica Krepp from Arlington County, Virginia, who will share the process Arlington took to adopt and implement healthy vending policies. Lastly, Hugh Dang from ChangeLab Solutions will present an overview of healthy procurement, as well as the legal considerations to take into account when developing policies to improve access to healthy foods in the municipal workplace. As you may remember, when you registered for the webinar, we asked you what barriers you face to eating healthily in the workplace. We summarized and shared these responses with our panelists, who will be addressing the real challenges faced by webinar participants. So why should we focus on improving access to healthy foods in the municipal workplace anyway? I will avoid citing statistics about how obesity and subsequently chronic diseases such as diabetes and heart disease are on the rise in the United States. You know this, either professionally or anecdotally. Obesity and chronic disease should be of concern to employers and to municipalities for two main reasons: cost and quality of life. The Centers for Disease Control and Prevention estimates that $147 billion were spent on obesity-related medical costs in 2008, and these expenses can impact an employer's bottom line through health insurance premiums. Additionally, research suggests that healthy employees are more productive and have less absenteeism. The second reason that this should be important to employers and to municipal leaders is quality of life. People, both local government employees and residents, want to be healthy, but need environments to support them in making healthy choices. Think about the last time your determination to eat nutritious foods got derailed by the temptation of a soda and potato chips down the hall in the vending machine. All the nutrition education and workplace wellness programs in the world mean nothing if the only choices available in the office or around town are high in fat, sugar, sodium, refined grain, and are highly processed. As you see by the statistics on the screen, people are trying to eat healthier, especially at this time of year. And the workplace is an ideal venue for targeting healthy eating, especially considering that for 9-to-5ers, 43% of their meals and snacks occur within the workday. An added bonus of working on healthy food access in city or town hall is that when residents come to visit the government facilities, they too can benefit from expanded access to healthy food. If that is not convincing enough, it may be important to consider the principle of equity. Here I would like to quote an idea that one of our speakers, Hugh Dang, suggests in his publication on healthy government procurement. For employees who work nights, weekends, or other off shifts, vending machines may be the only source of food or drinks available during their work hours. So we want to make sure that for those people, as well as people who 43% of their meals occur within the traditional 9-to-5 workday, that everyone has options to eat healthy food. And municipalities have the power to change the food landscape in their city halls and town-operated buildings, and can use the tools we will discuss in this webinar to make those goals a reality. Before we get into our content, we would like to hear from you. We want to get a sense of where your municipality or organization is at with policies related to foods provided at workplace meetings. Please take a moment to answer the poll that is on your screen. Okay, so we see some of the answers coming in. We overwhelmingly see that people don't have policies but are thinking about them. And we definitely do have a couple of people with policies in place. So great, thank you so much. Very helpful for us. Now let's begin with our speakers. Our first featured speakers are Sarah Rubin and Amy Friedman, hailing from Minneapolis, Minnesota. Sarah Rubin works as a public health specialist who coordinates the state health improvement process, healthy school food environment interventions, and worksite strategies. Sarah co-chairs the City of Minneapolis Wellness Committee and spearheaded SHIP Healthy Eating Interventions at the Minneapolis Park and Recreation Board. Sarah also coordinates the Community Transformation Grant Healthy Institutions activities, including a strategy to improve the food environment in after-school programs across Minneapolis. Amy Friedman works in the City of Minneapolis Benefits Office and coordinates employee wellness programs for city employees. She co-chairs the Citywide Wellness Committee, which has implemented a variety of initiatives, such as physical activity challenges, online wellness portals with incentives, a healthy food policy, and stairwell enhancements. Sarah and Amy, we look forward to hearing from you.
Thank you, Marisa, for the introduction. I'm Sarah, and Amy and I will be tag teaming this session. We will cover the City of Minneapolis's healthy food policy, some background on why the city developed one, and the process and lessons learned. The impetus for the policy began with the Minneapolis Health Department receiving money for the statewide Health Improvement Program, otherwise known as SHIP. SHIP is part of the Minnesota Reform Initiative that was signed into law in 2008. The focus of SHIP is to help Minnesotans live longer, better, healthier lives by reducing the burden of chronic disease. SHIP requires a policy, systems, and environmental approach to increase physical activity, improve nutrition, and reduce tobacco use and exposure. Every community health board across the state of Minnesota received funding to do this work in 4 sectors: community, schools, child care, and work sites. The Minneapolis Health Department decided to use the City of Minneapolis as a work site because we have 4,000 employees, and we thought it would be best to clean up our own house before working with other work sites. The start of the comprehensive worksite wellness initiative within the City of Minneapolis began with an assessment of city employees and city facilities. This was conducted to explore the options and interest of employees in improving food selections and to get a lay of the land as far as what was being offered. The next step was to develop, pass, and implement a healthy food policy for the city staff. Additionally, work was done to create and support active workstations and support amenities for staff, such as changing facilities and showers. Now Amy will discuss the wellness resolution and employee health assessments and policy development.
Before we get into the development and contents of the actual policy, I thought we could take a step back and look at what happened to lay the groundwork to make that happen. It all goes back to 2006 when the City Council passed a wellness resolution which established a comprehensive citywide health and wellness program that affirms the city's commitment to employees' overall health and well-being. The resolution acknowledges the importance of a wellness program, establishes the formation of a citywide wellness committee, and resolves that departments allow and encourage employees to participate in health and wellness activities. We have been able to use this resolution as support for many of our initiatives. To help us focus our wellness programs to the areas that would be most beneficial to our employees, we collect data in a number of different ways. We conduct an annual health assessment where we are able to get information about employees' overall wellness. Each year, poor nutrition and being overweight are among the highest areas of risk. In addition, in 2010, we conducted a wellness survey that looked at what areas of health and wellness employees were interested in. One subject we inquired about was a healthy food policy, and 70% of respondents indicated that they supported healthy guidelines for internal meetings, city-sponsored events, on-site vending machines, and department common areas. Using the data collected, the Wellness Committee decided that we wanted to pursue a citywide healthy food policy. Some members of the Wellness Committee were reluctant to pursue such a policy because they knew it would be met with resistance by employees in their departments. But after a good amount of discussion and about several months, we finally decided to move forward. The Wellness Committee drafted a policy that supports the health and wellness of city employees and ensures the availability of healthy options when food is served. We secured a City Council sponsor for the policy, Councilmember Betsy Hodges. We have been fortunate to have Councilmember Hodges as an advocate for our programs and of the wellness program as a whole. She worked with us several times on any issue where it would be beneficial for her to do so in her role as a City Council member. Councilmember Hodges was just sworn in as the mayor of Minneapolis last week,
earlier this week, and we have every reason to think that we will continue to have her support in her new role. Councilmember Hodges sponsored this policy and led us through the council approval process. As part of that process, we had individual meetings with the council members who served on the council committee that would be initially voting on the policy. This gave us an opportunity to gauge their level of support, address any concerns they had, and even tweak the policy where necessary. This was a key step in getting this policy passed through the council. Of course, we did run into some bumps in the road. One of the biggest concerns we heard from city council members and others was that we were infringing on employees' rights by telling them what they could and could not eat. We were able to address this concern, and we did end up making some changes to the policy to accommodate concerns like these. The policy was definitely not as strong as it started out, but it still achieves the primary objectives. Although the policy made it through the council committee without much of an issue, several of the supportive council members from the committee were not at the full council meeting at which they voted on the policy. So we were not prepared for the fact that it would struggle during this meeting and it barely passed the full council. In fact, during the meeting, we weren't even sure that it had passed. But luckily it did, and in October of 2011, we had a newly passed healthy food policy. Sarah is going to tell you more about the policy and its contents.
So one of the City of Minneapolis' goals is to have livable communities and healthy lives, where healthy choices are easy and economical. The purpose of the policy was really to demonstrate a commitment to employee health and to create an environment that supports that commitment through providing healthy food options. The Wellness Committee and Health Department wanted to create a model policy that was comprehensive and included all of the ways that city funds are used to procure food for employees and community members. So the policy applies to city staff that use city funds to purchase food, any contracted individual or organization that use city money to purchase food, and any vending machine owner or operator or cafeteria that sells or provides food in city buildings. The policy scope covers vending machines, internal and external meetings, contracts, and cafeteria and food service. When there are events where employees purchase and provide food using their own money, they are not required to follow the policy guidelines, but it is strongly encouraged. The following guidelines align with the USDA guidelines for Americans. The expectation is that staff include the following guidelines and practices when making decisions about food to ensure that healthy foods are available. Currently, Amy and I are in the process of training city employees on how to follow this policy. So we learned a lot through this process. Convening a wellness committee for support and guidance was crucial in the process. The committee made decisions about the policy, and because it is made up of representatives from different city departments, there was a staff that was knowledgeable about the policy and able to communicate it to their colleagues. Engaging a champion to sponsor and advocate to leadership and members of their committees and fellow council members. Meeting with council members to introduce the policy and to hear their concerns so that they can be addressed before the vote, and then make sure that you address those concerns. It's important to always start with the strongest policy language, knowing that there will be some compromising in the process. And this isn't a loss. The best policies are the ones that people believe in and will follow. There's always time to reassess later and to strengthen the policy. So here is our contact information. Please feel free to contact either one of us if you would like more information or have questions. Thank you.
Thank you so much, Sarah and Amy. Really appreciate that presentation. One of the things that I thought was particularly interesting was how you talked about that when you surveyed people, that 70% of respondents said that they wanted access to healthier foods, and that's similar to what we posted in the beginning, that 74% of people, according to the American Snack Food Association, are trying to eat healthier. So yet again, more evidence that people want to be able to make healthy choices. They just need food environments that enable them to do so. So as I mentioned in the beginning, we will have a question and answer period at the end of the 3 presentations. But I highly encourage you to submit your questions and comments for Sarah and Amy in the chat box to the right. As we prepare for our second speaker, please take a moment to answer the poll question that will be popping up on your screen. We are curious to find out how many of your municipalities or your workplaces have policies that require that healthy foods are available in vending machines. So please go ahead and take a moment and answer this poll on your screen. So once again, the trend we're seeing is that folks don't have a policy, but are thinking about it, and that we do have some folks with policies in place. So again, thank you so much for your answers on this. Very helpful for us. Next, we will hear from Erica Kretz. Erica is the Community Health Promotion Coordinator for Arlington County's Office of Community Health in Arlington, Virginia. In this role, she has been the catalyst for the expansion of the FitArlington Healthy Vending Initiative into all parks, community centers, government employee sites, and soon to be used in all public schools. Prior to joining Arlington County, Erica worked for the New York City Department of Health, where she implemented healthy vending machines in over 30 hospitals. So, Erica, we look forward to your presentation. So, actually, Erica, one second. We're having a hard time hearing you. If you would like to unmute yourself, that would be great. Thanks, everyone, for your patience. Give us one second while we unmute Erica. So again, please bear with us for a moment while we are dealing with this. We're especially excited to hear from Erica because she has so much experience implementing healthy vending, and that was one of the things that a lot of people talked about when we talked about barriers.
Does this work?
Yeah, we can hear you now. Perfect, Erica. Thanks so much.
Well, thank you, Marisa. All right. Thank you, Marisa, for the introduction, and I'm honored to speak to you today about Arlington County's FitArlington Healthy Vending Initiative. Here is an overview of the presentation, making sure that we cover the action steps we took and provide some food for thought for any of you that are considering developing a similar policy. First, I'd like to establish why vending is a good area for healthy workplace policies. To start, the vending industry has been allowed to sell unhealthy items for decades without anyone noticing or challenging what they can and can't stock, so there is an obvious need for nutritional guidance. Because it is a PSE approach, it will have a larger and more sustainable impact. Also, vending machines are a significant way to impact employees' access to healthy foods because of their convenience. Some offices don't have food options nearby, and so vending may be their only source of food during the workday. Lastly, as an employer, you have control over your contract and can dictate what goes in the machines. This control provides an easier approach than other healthy food policies that rely on self-regulation, such as healthy meeting policies or healthy celebrations. The Healthy Vending Initiative is part of FitArlington, which is a countywide plan to promote a culture of fitness and is the product of County Board Chairman Walter Tejada's vision to maintain Arlington's long tradition of being a model of health. Using the umbrella of FitArlington, the initial goal was to implement a policy to improve the vending machines in the Department of Parks and Recreation sites. We were fortunate to have funding from the Virginia Foundation for Healthy Use, which helped fund marketing and education efforts to increase the likelihood of a smooth transition. After the successful implementation in Parks and Recreation locations, we expanded to other county employee sites. The policy for employee sites only differs by using a phase-in process and some minor product variations. Since many of you joining us on this webinar are located across the country, I wanted to quickly introduce you to Arlington County, which is located in Northern Virginia and is the most densely populated county in the region. It is the geographically smallest self-governing county in the United States, occupying slightly less than 26 square miles. This map of Arlington shows the timeline and distribution of the healthy vending machines beginning in March of last year. To date, there are 17 community sites and 13 employee sites. The last phase is installing in all of the public schools in January to further our goal of a truly countywide policy change. So how did we do it? I have listed out the steps we took and will refer back to this slide throughout the presentation to go into more detail. Our first step was information gathering. Then we identified the key players, scheduled meetings with them to give them the sales pitch and garner support, developed nutrition standards, planned and executed an education campaign, and established a framework for monitoring compliance. You will not be surprised to find when asking around your various departments that most employees don't know how the machines got there or who manages them. So as a first step, we sent surveys to any vending machine coordinators we could identify to determine the types of machines currently in place, which vendor they used, concerns or issues with current vending, funding generated, etc. In addition to the survey, we also did benchmarking, which was more specific to developing nutrition standards, which we'll get to shortly. Arlington is fortunate to have visionary leaders to support this type of work. If your jurisdiction is not as privileged, I encourage you to cite these quotes as inspiration for them to step up and be a leader for health. As many of you know, it is essential for any project or policy change to have buy-in from many different stakeholders, but top-down support can make the process much easier and faster, so starting at the top is your best bet. Then you can provide the education and gather support down the ladder. Having a positive working relationship with your vendor is critical, and keeping some of the following concepts in mind may be helpful in approaching difficult conversations that may arise. For example, praising them for being pioneers in the health movement and applauding them for being ahead of the curve always helps. Also, there are some intrinsic common goals that are good to remind them of, particularly when it comes to talking about money. You both want to increase sales. For you, that means your employees are getting better, healthier products and validates the success of the policy. And for them, it helps their business. Ultimately, when in doubt, remember that you are the customer and are therefore in the driver's seat. We researched what others were doing across the country to avoid reinventing the wheel, and I provided some examples with links on the slide. Defining what constitutes healthy is key, since it is a relative term. In the end, we determined we would base our nutrition standards off of the USDA competitive food standards for food sold in schools because we want to be consistent with what the schools were offering and what is widely accepted from experts in the field. In some cases, we added standards to make it more stringent, and in other aspects, put in more flexibility, especially for employee sites. We will share the entire nutrition standards document after the webinar. If you have specific questions around the details of the standards, I would be happy to answer them when we are opening up to questions or discuss in more detail after the presentation. In a nutshell, the employee snack machines have at least 50% of the products meeting the USDA standards, and the additional criteria listed on the slide. We felt these other conditions were important to include to make sure the machines were balanced and visually appeared healthy. Because without some of this language, you could have 99% of the machines stocked with chips, and even though the chips would be less than 200 calories and meet the other nutrition standards, it wouldn't visually appear healthy to the consumer. To implement the nutrition standards, it is helpful to build a product database that includes the nutrition information for a variety of products. I've included some links to sources that have product examples to help build your database. After you have a database and can narrow down which items meet your standards, you can build a planogram. A planogram is a tool that guides the types of products and placement in the vending machine. Here is a sample of our employee beverage nutrition standards, which will also be shared after the webinar. Again, we added standards on top of those provided by USDA. We decided to adopt a similar policy to New York City by allowing only 2 slots of high-calorie beverages, which are placed at the bottom of the machine, which has been shown to be an effective way to decrease consumption. We are currently piloting a healthier hot beverage machine using these standards. The feedback has been really positive from staff thus far. These before and after photos give you a sense of how drastic the change was. You can see the huge honey buns on the bottom row and an entire row of chocolate and candy. Then, on the right, there are nuts, 100-calorie packs, baked chips, and crackers. So even though there are still some unhealthy options, it is a vast improvement and is continually moving towards 100% healthy. The next step is to write a contract that includes considerations beyond the nutrition standards and mirrors your policy. Based on our experience, these are the components we recommend including. Having a communication structure in writing is nice to have to keep everyone on the same page. We like to meet with our vendor about every other month. You want to include the commission rates. We chose to forego most of our commission to keep prices low for our staff. Also, making sure the advertising aligns with healthy messaging, making sure they provide products for the tasting events, and establishing which locations they will service. The current policy language we are operating under will also be shared after the webinar. The next step is to communicate the policy change to employees and provide nutrition education to help explain the importance of healthy eating and provide them the tools to make better choices. This is especially important if there are some unhealthy options in the machines. The funding from Virginia Foundation for Healthy Youth covered the printing costs for the posters shown that you're welcome to copy and use in your locations. We used them at tasting events and posted them in the employee lounges. We also circulated emails to advertise to our staff that the changes were coming so they knew what to expect. We have found that the staff is more receptive to the change if they feel that they were informed about it in advance and that the messaging is clear that the changes are for their benefit. Here are some photos from the 12 tasting events we held over the past year. The events are a great way to interact with the staff to get their feedback and provide direct education. We had local management for each location open up the events as advocates and had the county board chairman attend to show his top-down support. The grant funds were used to purchase all of the supplies needed for these events except for the snacks which the vendor provided per our contract. Here's a photo of our current machine with the customized FitArlington wrap and some helpful strategies to monitor compliance, such as taking photos to track progress. It is also good to have a team of vending police to make sure the machines are filled appropriately because the vendor is not going to take the time, but they will take the time to fix it once it is reported. Vending companies are structured differently, but some have technicians receiving commission from the machines they stock, so they're incentivized to stock what they believe are high sellers, which could include candy bars. So really, monitoring has to be an ongoing process. The most common concern we confronted was about revenue. We recognized there would be an initial budget gap, but were able to overcome it by having leadership support, by reinforcing that the county is not in the business of making money off of selling junk food to its employees, and by using marketing to bolster sales. Also, there is evidence that sales are not dropping that much when switching to healthy products, and that sales will stabilize over time. You can also cite examples of financial success, which I've included some links to. Some other ways to increase sales are hosting tasting events so employees become familiar with the brands they may not be accustomed to, and surveying staff for feedback. Here's an overview of some of the best practices we touched on and some good takeaways, like placing the policy under a political campaign or a countywide management plan if possible. Writing comprehensive, specific contract terms with flexible addendum ability. Requiring nutrition standards are included in all future vending contracts, so the provisions of the policy will apply to any new vendors down the road. Using one centralized contract to streamline issues and for easier compliance monitoring. Creating a small implementation team with a leader to take responsibility for shepherding the policymaking process. Building support by engaging employees from the beginning. Using planograms or something similar to ensure compliance with nutrition standards, and considering the need and sources for funding. I'd like to end with a call to action. The more municipalities and other employers that use healthy vending policies, the greater demand it will place on the market to manufacture healthy products, provide more variety, create competition to lower prices, thus making policies easier to implement. We challenge you to join the movement. Thank you so much for your time, and feel free to use my contact information on the slide if you want to get more details.
Erica, thank you so much for your presentation. We really appreciate it. And I really want to say thank you for addressing what was one of the greatest concerns that folks shared with us, which was the potential lost revenue. So I'm sure people will be taking advantage of those links that you posted. I also want to share with everyone that Erica and Arlington County have generously been willing to disseminate the nutrition standards as well as those posters that she was talking about. So we will send those in a follow-up email. So really appreciate that. And again, as I mentioned earlier, I continue to encourage folks to submit your questions and comments. So anything that arose during Erica's presentation, please feel free to submit those at this time. Our final presenter this afternoon is Hugh Dang, the Senior Staff Attorney and Technical Assistance Legal Director for the National Policy and Legal Analysis Network, NPLAN, to prevent childhood obesity at Change Lab Solutions. Hugh oversees the development and dissemination of legal and policy tools aimed at addressing the environmental causes of childhood obesity and has developed a toolkit for Change Lab Solutions on healthy government procurement. So Hugh, we look forward to your presentation.
Thanks. Thank you. I just got the little notice that I was unmuted, so I'm really happy to be here today. I'm really honored to be with these presenters who have given us some great success stories, which is something that I think most people love hearing about, and it's great to know that there are so many people on the call who are looking forward to moving forward with their own victories and successes in healthy vending and procurement. I'm going to be talking to you today a little bit about legal issues that are related to procurement and vending. And this is important here because often when you bring lawyers into this, one role that lawyers often feel like they have is to tell you no, is to tell you that you can't do something. It's important for you to understand all the different legal issues and considerations that are important with this so that you can then be able to say, well, why can't we do that? One thing I want to make clear is that even though I am an attorney, I am not, and today's presentation is not legal advice to you. You still need to work with your city attorneys and your other attorneys that are working with your contracts. What we're hoping to do by giving you some of these ideas and resources is the ability to bring things to your attorney's attention who may not always work in healthy vending or healthy procurement. And so these are things that you can bring to them and talk through in order to move towards that successful, healthy vending stories that you're moving towards. In terms of today's plan, it's pretty simple. I'm just going to go over a legal framework. I'm going to talk about bidding. I'm going to talk about contracting. I'm going to talk about enforcement. And then I'm going to talk about some of the resources that we have that you can use. In terms of procurement and a definition of what procurement is, in the simplest definition of procurement is it's purchasing. It's when government is shopping for goods and services. But, you know, it's a little bit more complicated than just this, because in terms of food purchasing, for example, governments do more than just purchase. You know, it's not the typical thing where, oh, the government wants food and so it has to purchase it. You have to think about what the purposes of that procurement are. There are a number of different things that government purchases food for, and one way of classifying it or thinking about it is that it purchases food in order to provide to certain populations, to you know, to dependent populations like senior centers or juvenile centers or hospitals that are government-run. It also purchases food in order to sell food or allows other people to sell on its property. This is the typical idea of vending and concessions. And then in the procurement arena, this is kind of a related idea. I'm not going to get into it too much, but government also regulates food purchasing. It regulates the sale of food in restaurants, stores, sidewalks, and street vending, farmers markets. You know, this really gets into a whole other area of land use policies and police power policies that can be used to make food healthier. We're not going to really get into that today, but I just wanted to throw it out there as you're thinking about all the different ways that government interacts with food purchasing. It's useful to think about all these things and really try to think of all the different places that you can effect change in terms of healthier vending. What we have typically seen is that we've seen it in a lot of parks and recs. We've seen it in schools. We've seen it in senior centers. And we've seen it in city and town halls. But it shouldn't be limited to these things. It's really, you know, all the areas that you can think of that you want to make this kind of positive change. It's not just places, it's also people. And one thing that I think that the speakers so far today, this morning, or this afternoon, have been really done an excellent job is talking about how you talk to decision makers, what you have to have prepared and do ahead of time, the kind of work you do with your employees and the other folks that are going to be affected by this, and you know, not assuming that that you're just going in and going to be able to do whatever you want, but really thinking about the people that you're working with. Here on this slide, the one thing that I have in bold here, having an understanding of procurement laws and other statutes is not by no means the most important part of this. It's in bold because it's what I'm really going to be talking with you about. So one way to think of procurement laws is they are thought of as good government laws, and that's what they've been. That's how they've been framed in the past historically. The whole purpose of procurement laws is to allow government to get purchase things that are of high quality, low cost. And those are the two main things. You want to make sure you're getting what you want at the best price possible, but there's actually a number of other considerations also that government has used. And these are perfectly legitimate purposes of procurement laws. They are to avoid things such as favoritism, improvidence, extravagance, fraud, basically saying we want this to be a fair process. We don't want someone to have an unfair advantage just because they've done business with government before, because they're buddies with someone. Those are things we want to avoid, so we have laws and procedures in place. The other purposes that we have out there, that procurement laws, other than just purchasing price and avoiding favoritism, purchasing has been used to further government interest in things like the environment. State laws, for example, could ban state agencies or localities from purchasing tropical hardwood products, or state laws could say that, you know, localities have to purchase reasonably competitive recycled products. State laws could direct elementary and secondary schools to use environmentally sensitive cleaning and maintenance products. Or there's a lot of green and sustainability rules that are being implemented nowadays in terms of purchasing and procurement. Another purpose that we see is with procurement laws to support local businesses. There may be geographic preferences or competitive bidding preferences for buying local. And that's something that is actually related to the healthy food movement also, and I'll talk about that in a little bit, because I think knowing and understanding that those goals go one together, healthy local, is an important asset that you can tap into. And then two other purposes that you don't hear about as much. One is remedying discrimination. You can use purchasing laws to give preferences to minority-owned businesses or women-owned businesses. That's been done in a lot of localities. And that's not what we're here to discuss today. What we're here to discuss today is, could you use procurement laws and purchasing in order to improve public health? And that's something that we're seeing happening across the country. And that's really where that's situated in this whole idea of good government law. And I think one reason why I talk about this aspect of procurement law and what it's about, and I think it's important because one of the barriers that you will come up with, you may come up against, is this idea that why is government telling people what they can or cannot buy, or what they can or cannot purchase? And the simple answer is that government has power over its own purchasing. It does its own purchasing for a number of reasons that it feels like are fair and responsible, and public health could be one of those reasons. I'm going to move on and talk now about bidding. I'm going to move through this pretty quickly. The idea with bidding is not that you have to understand every aspect of the bidding process and become experts in competitive bidding, but you have to understand that different laws apply. There are different procedures in place for things called invitations for bids, requests for proposals. The specifications, how you describe things, are important. Whether something is a good or services, and food services is often can be either one of those. Understanding that, and also understanding that there are local and farm initiatives going on in the bidding process, are all things that you may come across with. I just want to introduce those concepts to you so that you know, you recognize them when they come up. Many different laws apply. Mainly, it's state law that applies. The state laws will govern what local purchasing looks like, and will leave some of the laws, will also allow the local government to make some of those rules themselves. There are some federal rules, but really this is a state, this is really a state law-driven arena of law. It's also important that when you're talking about state laws, it's not just the statutes, but the courts also make decisions, and also governors and mayors may issue executive orders on healthy vending or healthy purchasing and things like that. So those are all things that you need to be aware of in your jurisdictions. One thing that comes up a lot is how you specify in your bids and your proposals and your contracts what healthy is and what those specifications might look like. So I put up this definition of specifications, and it's a little bit complicated, but what is really important to focus on is the fact that generally when you're dealing with specifications, you're being asked or required to talk about the type of product that you want to purchase and set up some standards around how you're going to apply those requirements. This is really important in terms of healthy food specifications, because from the very beginning, you want to work with defining the food that you want to purchase or sell. And this should be consistent or mirror the healthy food policy that you're looking at, the standards that our other speakers talk about. From a legal viewpoint, healthy food specifications are perfectly legal to describe in your contracts. They're only problematic or illegal if they are unduly restrictive, discourage competition, or specify one brand name only. And if you think back to the whole good government laws purposes of procurement, you can see if you define your healthy food so specifically that it has to be, you know, the purchase of one particular brand of apple from one particular, you know, region of your state, that could be against competition and therefore found to be non-competitive and effectively illegal. So that's one thing just to be aware of. Now, in terms of biddings, there are a number of different processes that go through with bidding and proposal process, and it's important to be able to recognize that basically the city's issuing these certain rules, and people are proposing, making bids on those proposals. There's different language is used for different things, and you need to become aware that there are different things like invitations for bids and requests for proposals. There's also different procedures in place when you're talking about permits, when a county is establishing a process for people to sell food. And then the last kind of bidding thing I want to talk to you about is something called the right of first refusal. And this is where one preferred vendor gets the right to submit a bid first. And this is something that you may encounter when you're working with in your states with blind vendors. Many of you who have worked with vendors in the past or worked with healthy vending in the past may have heard of something called the Randolph-Shepard Act, which is a federal law which gives this opportunity for blind vendors to bid first on vending contracts in federal buildings. Similar laws provide the same opportunities in most, if not all, state buildings. So legally, a blind vendor gets to, may be able to bid first on something, on a proposal. That doesn't mean that the vendor can stop a government entity from passing a healthy food policy or putting healthy food into their specifications. But practically speaking, blind vending groups are well organized and have a lot of goodwill and loyalty from policymakers. You know, these laws have been really successful at creating business opportunities for blind entrepreneurs. So it's really important to know that these groups may be involved in the bidding process and understand their goals and their legitimate business concerns, and then work with them in the process. And then I really want to talk about some of the contracting issues that Erica has touched on. One thing that you really want to look at is, in terms of contracts, is what's the contract that's existing? Is it an old contract? When does it expire? When can you negotiate a new contract? You want to include strong language, strong specification standards, not just in the contract, but also in the request for proposal. You want to centralize and bring together a lot of vending operations into your contracts. And typically, you want to keep contract terms really short. The reason to keep contract terms short is so that you can renegotiate them if new knowledge comes up. And then also putting in place really specific language about noncompliance. We have some examples on our website, our resources. We have model contract language that has this the terms that you can put in and pick and choose from. I'm not going to get into that today. Those are available on our website. And those kinds of discussions, the things that we've heard from Erica, things that you want to put in there, we have that model language available for you, and we hope you use those resources. I think I want to stop there in order to make sure that we have enough time for questions. But the one thing I want to leave you with is just the idea. I started today by talking about how often lawyers, are here really to tell you that you can't do something. And if you come up with that kind of resistance from the lawyers you're working with, that would be a good time to reach out to Change Lab, and we can maybe give you some of the information that you could bring to the lawyers you're working with so that they can say, hey, wait a minute, maybe this is something that we could do in our city or town.
Great. Well, thank you so much, Q. Really appreciate that. It's very practical and very helpful. I know we had a lot of participants when they registered asked about the Randolph-Shepard Act, so really appreciate you addressing that. So we're now going to move into questions and answers. The questions have been readily streaming in during the presentation. So for any folks who have not yet taken advantage of asking questions, we invite you to do so now. Please feel free to ask questions of any of the presenters by typing in the chat box in the GoToMeeting control panel. So at this time, I'm going to unmute all of our speakers, and we will be asking you a couple of questions. So to start, we have a question for Sarah and Amy. Somebody was wondering, you mentioned that you started with a strong policy and ended up having to water it down. So one of the participants wanted to know, what were some of the things that you had to take out and water down?
Hi, yeah. So I think one of the biggest things was really early on in the process. One of the things that some of the departments had tried to do was to tell employees, for instance, that they couldn't bring in like their extra candy and cakes from parties and leave it in the break rooms and kind of keep the whole office kitchen area healthy, and that was kind of nixed right away. People just did not want that area touched, as well as if there are potlucks or employee celebrations where maybe the employees are kind of going in on providing the food at that time, those are not regulated by the policy as well, although I know that at least in our department, in the health department, and some other departments, they do start to follow the policy sort of naturally, being used to providing healthy options. And I also think that, keeping it to providing healthy options and making the healthy choice the easy choice, as opposed to banning all unhealthy food, was really important as we had discussions with our council members and committee members and other people who were involved as well.
Great, thanks. That's really helpful, and I think that addresses kind of two things at once. One of the things being the challenge of changing culture. That was something that a lot of people mentioned as a barrier, and so that is nice to hear that through these policies and through their implementation that does seem to follow naturally. And then it also ties in nicely with Q's presentation on healthy procurement. And we want to remember here that we're not trying to manage how they're spending their individual money. We're really focusing on how local governments are spending their money when government is purchasing food, that they're adhering to a certain standard. So let's move on to our next question, which is for Erica. We had a participant who was wondering if you could please explain what a planogram is.
Sure. I'm not sure if you can actually switch the screen back to me because I can put up the graphic
Sure.
that I have.
Yep, I'll do that right now. Here you go, Erica.
Great. Okay, so here's the graphic on an example of a planogram. And so really every vendor is different, so some might not prefer to use this method. So then in that case you could use it really internally for your vending police team, if you will. And what it is it's really just a diagram, a graphic of what the machine would have if it complied with your nutrition standards. This example is really just kind of a broad example. You would really want to have something that would be very specific that would include the exact product brand name, the portion size, and then you would have the placement. So here it has baked chips at the top, and it has mixed nuts at the bottom. And so you do have to be mindful of what fits in this spiral, and it can get a little technical, but in general, a planogram really just gives you that visual of what the machine looks like if it applies to your standards.
Great. Thanks so much, Erica. So next we have, sorry, go ahead.
Oh, I just wanted to jump in there, too, about the planogram. I think that it's really useful for planning purposes, and it's also really useful to include that, attach that to your contract as a way to aid in both setting up the vending machines, but also for monitoring and compliance. And then also one thing that I didn't really talk about, but is in our model contracts, is really being very deliberate about things like pricing and placement of products. If you're talking about a situation where you're no longer doing 100% healthy, you started out saying you wanted 100% healthy items, but then it's been negotiated down to 75%, 50%, where those things are, the behavioral economics folks will tell you if something's at eye level, what does it mean? If something's lower, people may not purchase it as much. So the planogram is really useful for considering all of those things.
Great. That's really helpful, and I think that's just another tool to add to the toolbox in creating healthy vending machines. So thank you for that. So Q, we have another question. We have a question for you, which is, in your experience working in the arena of healthy vending and healthy procurement, have cities, towns, counties that have established nutrition standards for vending machines typically been able to get enough bids from companies for those healthy vending machines?
Yes, yes. In the experience that we've definitely heard the threat of not being able to get enough bids. Even in really big cities, we've heard that. We've heard, oh, you know what? We've already heard from our vendors that no one's going to bid on that. But that hasn't played out in those same cities where we've heard that. Cities like Philadelphia and Chicago may have heard things like that, but once that they've implemented it, they have been really successful. One area that we are working here in California with a lot is that that issue comes up in rural areas a lot, and so over there in the Mid-Atlantic, you may come across some of that too. I know that the region is very diverse, and so there may be areas that are less dense where you may come into some of those issues. And then again, the goal is to not see that as something that's going to stop you, but to try to think about, well, has anyone else done this in the area? Have schools done it? Schools have led the way in healthy vending, over the last, decade or so. So, are there any vendors and vendors there? Are there healthy product lists that you can get your hands on that will help the vendors? Because they may just say, well, we don't even know what the products are, and if you get the healthy product list from CSPI and you're able to, have that information, I think that it helps. It helps a lot. Also, the same Community Commons blog post that Erica cites in her post also links to, good vendors that you can reach out to. To kind of just get examples of how people are doing it.
Thanks, that's great, very helpful. And I really appreciate that you touched on rural areas, because that is in the Mid-Atlantic states, particularly in Maryland and Virginia, we do have a lot of rural areas. And I want to provide just another example of thinking outside the box of who some of these partners might be. And we did have a specific question about rural areas. So I'm just going to pull up a website. We'll include this in what we send out at the end, which is this is a hospital in Texas that used its purchasing power to buy nutritious foods, fruits and vegetables at a lower cost and then sell them to residents in the county at an affordable cost. And so just another example of an employer using their purchasing power to make healthier foods more accessible. So I will be sure to send that out for folks. So we have a question for Sarah and Amy. So this is when you mentioned the survey that you disseminated to City of Minneapolis employees. One of our participants wanted to know approximately what percentage of employees responded to that survey because they're having a hard time getting employees to respond.
We had actually about 25% response rate, which we were really happy with.
We were actually surprised because it was sort of an off, just kind of a let's do this, and we do other employee surveys in the city, and we thought people would be surveyed out. So I definitely think people liked the survey and wanted their voices heard. So we were really happy with that.
Great, thanks so much. So we're just going to ask 2 more questions because we're getting close to the end of time. But Q, we have another question for you, which is one of our participants wants to know, at what point in the process should we get our city attorney involved in this process?
I would say as early as possible. I mean, you want to do some of your, you can do your consumer surveys. Before that, you can start researching standards. Like a lot of your formative work, you want to have so that when you go see the city attorney, you have a lot of that information available. But in terms, you're going to need to contact that person just to find out, what are the operative contracts that are in place, like who holds, which contracts. And it's very, it's not just one particular person. It might be the purchasing department for, a whole, these agencies, but then this other agency might be quasi-independent and could hold their own contracts. So once you're done with your formative research, I would say, and preparation, I would go to the city attorney and, just open up those conversations.
Wonderful, thank you. So our last question is for Erica, but then also Q, if you have any insight, that would be welcome too, which is, Erica, you mentioned that sometimes the vendors change the food items in the vending machines, and our participant was wondering, how can the vendor change that if you have a contract for specific healthier food?
That's a really good question. It is not supposed to happen that way, but I did allude to the fact that it does because it's true, it does happen. And so they could give excuses as far as, citing ignorance or say that the approved item is out of stock and so they had to use a different item. There's really a number of excuses they can make. But at the end of the day, the policy, you can't argue with policy, which is why policy is so important and to have to refer back to. And so I would just suggest having that monitoring in place so that if there is a problem, you can identify it, and they will change it because it is in your policy, it is in your contract. So they know they're not supposed to, but there's usually a lot of people involved, so a lot of miscommunication can happen between the person in the warehouse and the technician who stocks the machines and the person who fills the trucks. There's just so many points of potential error that really to have that team to really monitor the compliance, make sure that everything that's in the machine meets the standards, and if not, that you have a contact person that's identified right from the beginning as your go-to when there's problems, and in your policy include a provision on how quickly they have to make those changes. So we have a 48-hour response time in our contract that's required. So whether it's just a machine issue because one of the spirals is caught, or it's not giving refunds, or anything that could happen with vending machines, they are required to respond within 48 hours per our contract.
Great, thanks so much. So that is all the time that we have for our webinar today. We hope that you're inspired to take action in your municipality or workplace, and we want to make you aware of some of the resources available to you. So first of all, I would like to post the speaker contact information, but I will share that perhaps before contacting these folks, we are going to send you the slides, we're going to send you the materials that Erica mentioned, as well as the links that were in the PowerPoint. So before you email them about those questions, please know that we will be sending them to you. But I wanted to make these contacts available. And then I also wanted to let any of you know who live in California, Colorado, Oregon, Maryland, or Virginia. I want you to know about a resource that's available for you in your states, which is the Healthy Eating, Active Living Cities and Towns campaigns. And these are partnerships between public health organizations and the state municipal leagues in those states. And the Heal Cities campaigns provide free training, technical assistance, and support to cities and towns to adopt the kinds of policies that we talked about today, as well as a number of other policies. So if you happen to live in one of these states and are interested in getting some more information or help on pursuing any of these policies, please get in touch with the people whose information I have listed on this slide. And as I mentioned, within the next week, please be on the lookout for a link to the recording of this webinar, as well as a summary sheet that includes resources that will help you make healthy foods more accessible in your municipal workplaces. On behalf of the Institute for Public Health Innovation and the Heal Cities and Towns campaign for the Mid-Atlantic, thank you to each one of our presenters and to all of our participants for joining us and taking time to participate in our webinar. We hope you have a wonderful day and a happy and healthy 2014.